Hi, my name is Dr. Kenneth Spielvogel at Barton Women's Health here in South Lake Tahoe, California. And I'm here to talk to you about 5 simple tips that you can put into play to potentially decrease your risk of an undetected cancer or serious disease, as well as steps that you can take for a happier and healthier life. Number 1 is our screening guidelines for pap smears have changed dramatically over the course of the last 3 years. It's very important that you get with your provider to outline a plan that works for you. Number 2, mammogram screening is very different depending on your family history and your potential risk of breast cancer. For women in at-risk groups, the screening guidelines are for much earlier screening. It's very important that you meet with your provider, outline a plan, and potentially identify if you are at an increased risk, in particular a genetic risk for an inheritable cancer. Number 3 is screening for what we call health maintenance labs, which would be in general a blood count, a metabolic panel where we look at your kidney as well as your liver function and other chemistries, a thyroid screen, as well as a cholesterol panel. A 4th one would be colonoscopy. Depending on age group and similar to breast cancer, your risk will change based on family history, as well as any potential comorbidities or other diseases or medications that you may take. Number 5 would be bone density screening. Depending on your age, medications you take, and other comorbidities or diseases you may have, a bone density potentially can detect osteopenia or thinning of the bone, as well as outright osteoporosis. Again, we encourage you to meet with your provider, come up with a plan regarding the potential for calcium supplementation, vitamin D supplementation, and also when it would be appropriate for you to undergo a bone density.